week on Africa Health Check.
So I don't think we're ready as a country. The government is not ready.
We continue our discussion on mental health in our African continent.
The youth are actually reaching out more for mental health services.
And look at ways to build awareness on this topic that many turn a blind eye to. And welcome to Africa Health Check, where we reflect on the health status of Africa. I am your host, Paladi. According to a World Health Organization survey, the COVID-19 pandemic disrupted the provision of critical mental health services in at least 93% of countries globally. This while at the same time facing an increase in the demand for mental health programs. On today's show, we will be discussing mental health awareness. And to help me with that, we have a life coach from Nigeria, Grace Edibo, who will be sharing her journey and her work. And I also have our usual commentators, Dr. Marianne Morethi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from these panelists, let us have a look at this week's feature.
My name is Dr. Naeem Dalal. I am a mental health specialist, a psychiatrist, born and bred in Lusaka, Zambia. And I'm currently practicing in Lusaka at the university, teaching hospitals as a psychiatrist. Other than being a mental health professional, I'm also a grassroots advocate. And I started quite early as a medical student, going out in the communities and creating awareness around health and well-being. So I started out as a high-achieving student. So through secondary school, I got good grades, and then I realized that I want to go into medicine. But as I went through medical school, I realized that there was a huge gap when it came to mental well-being. When we speak of Africa, we are talking about Africa from various different regions. All these regions have different cultures and different beliefs. There's need for us to actually look into all these different cultures and beliefs because there is a concept of transcultural psychiatry that we are aware of. But with the pandemic and with realizations of, health is a complete state of not just physical, but also mental and social well-being, as a continent we are realizing that we do need mental health services, particularly in the largest population on our continent, who are the youth. The youth are actually reaching out more for mental health services. And this is the difference that we are seeing from yesteryear generations, where people from the older generations were not really much aware about mental health, but with the younger generation, the youth are actually more open to reaching out for mental health services. When we talk about mental health awareness, we're looking at it from the perspective of whether people understand what mental health and mental illnesses are, and secondly, where to get help from should they need the support for mental health illness. Rural areas are already at a disadvantage because they do not have access to health services as in their close vicinity. So already that puts them at a disadvantage. But even when you look at urban areas, we do see a lot of young people that are advocating and requesting for mental health services. However, most primary healthcare facilities do not have mental health services embedded in the primary system. When it comes to mental health and mental illness, there is a lot of stigma on our continent. This is because of our cultural beliefs, which are positive factors, but can also be something that can be a barrier to seeking help. Religious understanding, spirituality, all of these can actually be a perpetuator of stigma in mental health services. So when I was in medical school, I realized that a lot of people were coming to seek help when it was somewhat late. And this led me to join community outreach groups such as doctors' outreaches, where doctors would actually go into peri-urban areas and have mobile clinics. They would take their services there. And with time, I created an initiative called Ganesha Initiative, where we are actually translating common mental health conditions based on local languages and understanding, incorporating culture, beliefs, spirituality, so that people are more accepting of mental health services and reach out. To everyone listening in and watching right now, I would actually say that we all have a role to play when it comes to mental health services, mental health education, mental health awareness. The first thing that I would actually request everyone to say is be open to share your vulnerabilities and reach out for help when you need the help. Also, I would actually urge each and every one of you to be the advocates, to demand for mental health services where there are none, because it starts with you and it starts with me. And finally, to the powers that may be, we need to actually take mental health at the forefront when it comes to services. And it's not just a health industry thing, it's also education, it's also finance, it's also social services. Because on the continent, we are seeing the mental health impacts and ripple effects of COVID-19. And as we're going forward, we are going to keep seeing them. So that is what I would like to share.
Really incredible work from Dr. Naeem for this week's feature, and we're going to jump right into it. Grace, hello and welcome to the show.
Hi, Gigi. Thanks for having me.
How are you?
I'm doing amazing. The weather right here is pretty amazing, and I'm really doing amazing. Thank you.
Lovely stuff, and I'm so happy that you could join us today. Let me just take this time to allow you to just introduce yourself. Tell us, who is Grace? What do you do? Where are you based?
Okay, thank you so much. My name is Grace Edibo. I am proudly Nigerian. I currently live in the Federal Capital Territory, Abuja. So I was trained a physicist. I'm a physicist, trained physicist. But after physics, I've gone ahead to study cognitive behavioral therapy and then life coaching and a whole lot. So I am a life coach and a cognitive behavioral therapist.
Lovely stuff. It's not in everyday life that you meet a life coach. Now, I want us to talk about the situational analysis, the current situation regarding mental health, either in Nigeria or in Africa. But are there some trends, something to share around prevalence, something to share about unmet need for the healthcare, mental health care services, But what is the situation, broadly speaking, regarding mental health awareness and service provision?
Okay, so I need to pause, and this pause is the pause of, oh my goodness, can we do better? Because it's so amazing to know that we are very far when it comes to mental health awareness. We are very far in terms of, in Nigeria, they talk about it. You get to see on social media, mental health, people talk about it a lot. But the real awareness, what it is, how it affects individuals, what people can do to improve their mental health, are people really aware of it? I'll tell you, on a scale of 1 to 10, we are still in 1, sadly. We are still in 1 because I would say when we go sometimes for our regular outreaches, we get to talk to people in the marketplace, we get to talk to people in offices, students, and the likes. And then you'll be amazed. When you talk about mental health, the first thing that comes to an educated person's mind, Gigi, is mental illness. This person, they relate, they say, oh, crazy, And because of that ignorance, for lack of a better word, because of that ignorance, people detach themselves away from the word mental health. So it is lack of awareness. People don't understand these things. And because they do not understand it, they try to dissociate themselves. Like, no, mental health and all of that. So to answer your question, we have a long way to go. We really have a long way to go when it comes to mental health awareness in Nigeria. I'll speak for Nigeria based on what I've been seeing around me. we have a very, very long way to go.
Absolutely, and the biggest gap, as you are saying, is knowledge, awareness, and reducing the stigma attached to mental health. I'm gonna now go to Reverend Achempong. Perhaps you could also share some insights into the situational analysis regarding mental health in Ghana from your work as a community leader, as a religious leader, some of the trends that you've picked, or some points or where the focus or priority needs to be regarding mental health.
Yes, Gigi, mental health in general, as Grace has said, there is little known about mental health in Ghana. I think it's not quite different from Nigeria. I think what people don't understand is, what does mental health got to do with my life in general? The thing is that your mental health is what makes you. It informs your productivity at work. It defines your interpersonal relationships. Your mental health is actually what makes you an individual in any community. Our definition of mental health issues in Africa, like Grace has alluded to, needs expansion, needs real, proper expansion, because when we talk about mental health awareness, what we are trying to do is to help any individual know and come to grips with what is going on in the person's life. Number two is to be able to help people find and access resources, help. The mental health institutions, professionals, people that can assist. Grace made mention of the social support that she had in her family, in her social colonies. And then thirdly, to actually destigmatize all these things around mental health. Because to the African, mental health has to do, and religiously, mental health has to do with spirits. If you say that you are having mental health problems, it means that some demon, the devil has captured you, and so you've gone crazy. That is short of the full scope of definition, because mental health can be caused by biological sources, psychological sources, environmental factors can all play upon the mental health. So this discussion on this forum is a necessary one.
Absolutely agree with you. And, speaking about how we tend to think that it doesn't kill, there's this quote I once came across a couple of years ago, and it just stuck with me. And it said, stress is the worst killer and the biggest killer, And I think maybe the perception is that, with mental health, sometimes you're not seeing a wound that is physically visible, a bruise, and you think, oh, she's doing fine, she has a nice smile, there's no how she could be unwell, and that is where the stigma, the discrimination, and even lack of access to healthcare comes in. I'm going to jump to Dr. Mary Ann. Maybe you could also just share reflections as a healthcare professional, but also from Kenya, about the unmet need for mental health services and programs.
Thank you, Gigi. And this is one of the most important discussions we need to have and we need to continue having, is about our mental health, our mental well-being. Because again, as you've discussed with the two panelists so far, all that influences how our day-to-day lives will be, how we conduct our lives, and also the general output. How do we sleep well at night? In Kenya, the statistics now show 1 in every 10 has some mental health issues, and the leading mental health issues here is depression and anxiety. And unfortunately, the current pandemic, because they're still within the pandemic season, has aggravated these mental health issues. Lockdowns, social distancing, fear of the unknown, this is a new disease, has had an impact on our mental health. And allow me to also mention about our healthcare providers, right from the lab to the medics in the front line, having to handle such a difficult situation, being short-staffed, etc., has aggravated these mental health issues and has actually boiled to a crisis. So for me, we have to start talking about it, talking and emphasizing that it's okay not to be okay, and so many other factors that we need to appreciate when it comes to our mental health well-being and mental health.
I couldn't agree with you more, Dr. Mary, and thank you very much for that. On the other side of this, I want us now to talk about concrete recommendations. What other stakeholders, including ourselves, can do to mitigate this gap in increasing access to services and information about mental health, and also close the show. But before we do that, let us have a look at the word on the street for this week.
We have well-trained health workers, but the issue is, are they being taken care of? That is the issue, because you don't expect me to put my life at stake, saving the lives of others, while the person who is supposed to save mine is doing nothing about it. Now, during the COVID-19, we learned that so many of our doctors were infected. Their families, did they do anything for them? Did they even take care of them? No.
And there is another issue here, there are so many people who are facing various challenges, regarding their mental health, but they can't accept to go, get, medical help or treatment. So those are the major challenges.
Welcome back. You are still watching Africa Health Check, and today we are discussing mental health awareness. Just before the break, Grace was telling us about the work that she's engaged in as a life coach in Nigeria. And now, Grace, I want you to sort of tell us about the NGO that you started. How did it come about? What is the work that you've done previously, and currently, what are you working on?
Thank you so much. First and foremost, the name of our foundation is Friends to Lean On Global Foundation. And the name Friends to Lean On is, to create that friendly atmosphere. So what we do really is to create awareness by going to schools, we go to the marketplace, we go to offices, and then we use platforms, social media platforms, to create awareness. First is to help people understand what mental health is. And then secondly, we also through short programs, through documentaries, by sharing how stigmatizing people that are going through one mental health challenge or the other can affect, even them indirectly, because we are in a society, we are in a community. And then if you say, mental health issues, this person is the one that is sick, it is not my business. Remember that this person is going to come into the society. And I like to use this illustration, when you're driving and you're driving alongside someone that's going through a mental health challenge. Look, anything could happen, and indirectly it could affect you. So what we do as an NGO is first to talk to individuals. As a human being, it is your duty to understand, educate yourself. If you have to go learn, you have to educate yourself to know what mental health is. So our foundation is all about mental health education. And last year, during COVID, very interesting, we went to the marketplace. And it was interesting when we talked about mental health, just like the Reverend said, people would say, God forbid, I rebuke it in Jesus' name. No. It is a spiritual something. We had to educate them. And we told them that as simple as, having financial issues, unresolved financial issues that you don't even know when next the money will come, and then you're becoming sad about it. You're finding it hard to deal with stressors, life's challenges, and then COVID. During COVID, that one was on another level. It affected everybody. So that's what our foundation really is about: educating people about mental health Yeah, and very importantly, to wrap up, is we also teach people simple things that they can do when they are anxious. Breath work, self-care. Talking to professionals, sharing pains, and opening up. We share things, little things that they can help, and then when they know that it's becoming beyond what they can handle, they should seek professionals. But we teach them the first aid of taking care of their mental health so that they are able to deal with life's challenges and stressors as the case may be. So pretty much that's what our foundation is about.
Absolutely lovely stuff. And this, they say, the biggest investment that you can make is in your mental health. So I'm really happy that you're raising awareness and really sensitizing the public about the importance of reaching out, checking out on one another, and making sure that we are all well, and that seeking help, reaching out for assistance does not mean that you are weak or you are lesser of a person, but it's actually a sign of strength. I'm going to go to Reverend to give his a parting shot, but now I want you to speak to stakeholders. We have this unmet need for mental health programs, especially in Africa. What is your message to stakeholders regarding that?
What I would say is that our leaders need to open up to education, personal education, read, seek information about this particular area is necessary. The underlying theme of all this discussion is education. Let our opinion leaders take up the charge and do that.
Absolutely agree with you, Reverend. And I guess since you are a religious leader, it's befitting for me to also say that I think even in churches, let us have these conversations about mental health awareness. Cultural leaders in their cultural gatherings, let us make a conversation, because raising awareness and education goes beyond the schooling system to also how we ensure that in our spheres of influence, we bring out the message, we demystify the misconceptions, and we raise the necessary awareness. I'm gonna go to Dr. Mary Ann, your 1 minute parting shot about what needs to happen to ensure that we meet this unmet need for mental health programs.
I could not agree more that we need more resources, more people, more of us talking about mental health, because again, as been the theme of this program, teamwork, community participation is key for a healthy society. So for me, when it comes to mental health, and I'll speak from the medical and healthcare point of view, we have now frameworks right from WHO that has now policy papers. And also in Kenya, we have the mental health policy 2015 to 2030 that is now safeguarding this issue of mental health. Reverend has spoken about very few numbers of healthcare providers who are psychiatrists. And with these policies now in place, it makes sure that the government channels enough resources to train enough counselors, enough psychiatrists, enough mental health experts to make sure that we are safeguarding the mental stability and health of our communities within our country and within our continent. And here again, all these policies and frameworks that are being implemented are to safeguard our health and also our socio-economic impact within our community. So again, if we are well looked after in terms of our physical health, mental health, of course, spiritual, and all the others, all work in unison to make sure that we have a well looked after community, society, who are productive, contributing to the economy of their societies, the well-being of the economies, of the societies. And again, as I say, a healthy nation is a wealthy nation. So all these aspects play a big role in ensuring that we are prospering in all that we do.
Absolutely agree with you, Dr. Marianne, and thank you for sharing that. I know that in your line of work, you will continue with the advocacy and pushing wherever you can. Before we wrap up the show, I want Grace to have the parting shot. I want you to speak to a stakeholder listening to you right now about the urgent need for us to prioritize mental health awareness and services and programs. Like, it needs to stop being an opportunity cost.
Okay, thank you so much. So this is very, very important, because this is, for every time we're having such conversations, I always look to the solution, because it's the solution that counts. One thing I would say is awareness is key. They should throw more awareness. There shouldn't be enough. As a matter of fact, every station should have, like the media houses, should have a portion where they give at least 5 minutes to talk about mental health. It should be enforced that if you have a program for the day, what segment have you created to talk about mental health? So I would love for that to be introduced, to media houses. And then secondly, we have, I remember when we were in school, we had physical health education. I am advocating that mental health education should be introduced into the syllabus, because this is very huge. We have a lot of things happening around us and we're wondering why. This is traceable to the mental health, or the state of mind of these individuals, creating the issues that we're trying to deal with in the society. So if we start to educate them, they would not go into drugs, they would not go into things that is affecting us right now. So I would say that it should be introduced into schools as a full-time course, not just just a drop off here, you see it in one basic study. No, it should be a full course. Like we have physical health education, let's also have mental health education, so that we know that our kids are learning some of these things from school. So that's what I would say would be my recommendation, and it should be passed and enforced. Thank you so much.
Absolutely agree with you, Grace. As you're talking about how mental health should be introduced in schools, I was just thinking that we also need to make sure that this information also reaches our parents and our elders, because we are losing a lot of young people to mental health issues. It's reminding me of a trend that I saw on Twitter, I think a year or two ago, where people were saying, react like an African parent, and they'll say, how are you depressed? I bought new shoes for you. Or why are you saying you are stressed out when I bought new clothes for you? It just shows you how there's a disconnect between understanding mental health, triggers, indicators, access to help, and how we take it sometimes so simply and casually in our African culture. So thank you so much, Grace, for making time and sharing your wonderful work. Do continue as a life coach and spreading the awareness. Thank you as well to Reverend Achampong as well as Dr. Marianne. Your insights are appreciated as always. They say if you are not part of the solution, then you are part of the problem. So I want you to ask yourself, what are you doing today to raise awareness about mental health, to increase access to mental health programs and services? And this could just simply be by taking care of yourself and the person next to you. This is Africa Health Check. Do connect with us on our social media platforms. Until we meet again, same time, same place, same date. Remember that the future is Africa, the future is today.